Hey everyone, let's just dive right into this explainer today. We're starting with a pretty bold, straightforward statement. At Maya Laser Spa, we do this. We're going to take a deep, really focused look at one of the most transformative and frankly, kind of misunderstood procedures out there in the skincare world. I'm talking about CO2 fractional laser resurfacing.
So, by focusing on that core premise, we do this. Our goal is to completely demystify the fears you might have around the pain, the cost, and of course, the downtime of the CO2 fractional laser. There's just so much noise out there about lasers. Some folks think they're literally impossibly painful, while others completely underestimate the recovery. Well, we're going to cut right through all that noise with just pure, grounded facts, so you can actually make an informed decision.
Okay, here's our quick roadmap for today. First, a welcome to fractional CO2. Number 2, the science of resurfacing. 3, benefits and acne scars. 4, the procedure explained. 5, your day-by-day recovery timeline. And finally, 6, protecting your investment.
All right, Section 1. Welcome to fractional CO2, demystifying the laser.
First things first, we really need to clear the air right away. Because listen, this isn't your mother's terrifying, overly aggressive laser from the old days. The technology has evolved massively. It's infinitely more precise now. The core concept we're dealing with here is called fractional photothermolysis. Okay, I know, that sounds like a huge mouthful, right? But just think of it like aerating a lawn. Instead of completely tearing up the whole yard, which, by the way, is exactly what the old fully ablative lasers used to do, this fractional approach just pokes tiny, super precise holes. It leaves the surrounding grass entirely untouched. And because that surrounding healthy tissue is completely spared, it kicks your body's recovery into absolute overdrive, so it heals so much faster.
Moving on to Section 2, the science of resurfacing, how it works.
Now take a look at those tiny white dots. Those are the microthermal zones we were just talking about, created in this really precise grid pattern right on the skin. What's happening is the CO2 laser uses a very specific 10,600 nanometer wavelength that perfectly targets the water in your skin tissue. By instantly vaporizing that water, it creates these highly controlled micro-injuries. Instantly, your body reacts by saying, "Whoa, we have a wound," which triggers this massive, completely natural wound-healing response. And the result? You get this profound rush of brand new collagen and elastin production. It literally tightens and rejuvenates your skin from the inside out. It's actually pretty amazing.
So a crucial point here is comparing this to its main competitor, right? The erbium laser. Now, while the erbium is definitely cheaper, it averages around $800, and it has a shorter downtime of about 5 to 7 days, the penetration depth really tells a totally different story. Yes, the CO2 does have more downtime, usually 1 to 2 weeks, and a higher average cost of about $1,200. But here's the kicker. It penetrates up to 800 microns. That is literally twice as deep as the erbium's 400 microns. So that depth is exactly what makes the CO2 laser the ultimate tool for really profound structural remodeling instead of just, surface-level polishing.
Section 3, benefits and acne scars, the 50 to 80% difference.
Okay, so how does all this science actually translate into dramatic benefits in the real world? Well, for folks suffering from atrophic acne scars, those really stubborn, deep, pitted scars left behind after severe breakouts, clinical data shows a staggering 50 to 80% improvement in skin texture. That is huge. Because of that 800 micron depth we just talked about, the laser literally breaks down that old scar tissue and builds entirely fresh skin in its place. In fact, Dr. Chip Cole, who's a leading plastic surgeon, notes that for a lot of patients, this is often a phenomenal one-and-done treatment. You don't necessarily have to keep coming back for 5 or 6 agonizing sessions just to see life-changing results.
All right, Section 4, the procedure explained step by step.
By now, you're probably wondering, okay, what actually happens in the room? If you do decide to sit in that treatment chair, here is exactly what the physical procedure is going to look like. Step 1 is honestly all about comfort. Thanks to some very strong topical numbing creams, the actual procedure usually only causes this mild pricking sensation. In fact, most patients are fine switching to just plain Tylenol by the very next day. Step 2 is the laser application itself. And here's the cool part. Because the doctor can digitally control the exact width, depth, and energy level of the laser, it's infinitely safer and way more precise than an unpredictable chemical peel where, let's be honest, acid is basically just painted onto your face. Then steps 3 and 4 are immediate cooling with ice packs, followed by the application of biocclusive films or heavy ointments. This is absolutely crucial to protect that fresh, super vulnerable skin barrier right out of the gate.
Moving on to Section 5, day-by-day recovery timeline, surviving the downtime. Okay, let's dive right into what is probably the most highly anticipated part of this explainer, a completely transparent day-by-day guide to your recovery.
I'm not going to sugarcoat this for you. We really have to normalize this process, mostly so you don't completely panic when you look in the mirror. So days 1 to 3, they are going to look and feel like a very significant, very intense sunburn. Your skin is going to be red, it's going to be swollen, and it might even ooze or weep fluid. Listen to me, that is entirely normal. Don't freak out. By days 5 to 7, that weeping transitions to this intense dryness, tight peeling, and some crusting as the old skin finally sloughs off. And then, the magic really happens in week 2. Between days 8 and 14, re-epithelialization completes. Basically, that means your skin completely seals itself back up and this fresh, tight, very pink skin emerges.
And that naturally brings us to the famous pink stage. Look, it is entirely normal to look a bit pink for literally months. Why? Well, it's because of the massive extra blood flow that's actively required to build up all that new collagen and heal your skin. Clinically speaking, this pinkness, or erythema, fades really gradually over about 2 to 3 months. Sometimes it can even take up to a year to entirely disappear. But here is the fantastic news. Once your skin is fully closed up, which usually happens after about 2 weeks, you can safely cover that pinkness with some good mineral makeup and get right back out there into your daily life.
Which brings us to our final section. Section 6, Protecting Your Investment, Insider Tips.
So, now that you've survived that intense recovery timeline, let's reveal some really practical insider tips from the experts to make sure your brand new skin absolutely thrives and you get the best possible results. Dr. Chip Cole actually has some brilliant advice for these critical early days. First off, he recommends doing a beauty parlor-style hair wash in the sink, leaving your head backwards so that none of that dirty, soapy water runs down onto your healing face. And because you're going to have all these thick, protective ointments kind of mashed into your hairline, he even suggests using a little bit of Dawn dish soap, just once, to cut right through that grease. When you do touch your face, use a super gentle finger pad massage only. Absolutely no aggressive washcloths. You do not want to accidentally tear that delicate new skin. And finally, avoid anything that makes you sweat. No saunas, no hot yoga for at least 1 to 2 weeks. Plus, strict sun avoidance is non-negotiable here. Your new skin is basically baby fresh, and it is incredibly vulnerable to UV damage.
So, you might be asking yourself, why in the world would I go through all of this effort? Well, because of this number right here. 10 to 15 years. Yep, if you maintain what Dr. Cole calls your skin fitness, meaning you use quality skincare, you check in with an esthetician, and you strictly avoid sun damage, the profound collagen-boosting results from this single one-and-done procedure can amazingly last you for a full decade and a half.
Which leaves us with a pretty fascinating final thought to chew on today. Considering the incredible, genuinely lasting scientific transformation that we've just outlined for you, is 1 to 2 weeks of intense, sunburn-like recovery a trade-off you're actually ready to make for 10 to 15 years of dramatically rejuvenated skin? Honestly, think about that as you map out your own skincare journey. Thank you so much for joining me on this explainer today, and as always, keep asking the smart questions.